Hi guys, good morning to one and all. This is Dr. Satyabama for Raw Online. The topic for today is about antibiotics. I know this is a huge topic. But the oral maxillofacial surgeons need to know a bit about these antibiotics so that you are not confused in the choice that you make. You know very clearly what to give, when to give, what protocols are there, how do you go about doing this, what kind of infections are you dealing with, what is the predominancy of the microorganisms in that particular area. You need to know a range of things to be not only the surgery is important, the post-operative care is really very important. So how do you go about doing all of this is about this lecture today. So oral cavity, all of us know, is loaded with microorganisms. Tell me about it. COVID, not only are they doing it in the posterior nares, but they are also doing it posterior part of your fauces, yeah, and your oral cavity, and we are playing ourselves into the oral cavity. I remember still that in my undergrad days, okay, we used to be working without gloves. You heard it right. We did not have gloves then, and so we used to be playing with blood, playing with saliva. This was sometime in the 85s to 90, and then slowly gloves were starting to come. People are using it for surgical procedures, but they're not giving us for normal extractions and undergrad procedures, okay? And this is at Meadows Dental College, okay? So imagine the volume. A day, an intern would be doing about 70, 80. An intern will be standing there. Patients will come in a queue, have their injection given, then come in for their extractions. So you're like, which tooth? Okay, go, done. There will be somebody else who will be writing the medicine slip, and they will give it to them. That's it, we're done. Okay. In that interim period of me taking the tooth and putting a cotton, I will tell them, keep this cotton under pressure for whatever time. It used to be 1 hour then. And then not to spit, not to rinse, not to eat anything hot. Quickly, very quickly. Does this get into his mind? Does he or she really understand what is happening? We knew nothing. Our idea was to clear the crowd. The huge crowd standing in front of oral surgery used to be number 3 in front of oral surgery, and we have to clear the crowd by about 10:30, 11. Okay, but sometimes it will be horrendous. It will be going on till 11:30, 12 o'clock, and we take turns to just go have a rest for a minute. Okay, such was the volume of cases in the government dental college then in Chennai. All right, so what did we care about? What did we look at? Are we worried about ourselves getting infected with anything? Did we put them on antibiotics? Did we give them an antibiotic cover? Did we do anything with those patients? Nothing. And these patients are ones who are now getting infected with COVID. Imagine that immunity level that was there then is not there, but still it is high. I think let's not get into the controversy of how the infection has spread now. We'll leave it there. So antibiotics are always given, okay, to kill the microorganisms. The oral microbiome, if you look at it, is comprised of over 700 prevalent taxa. Okay, at the species level. Where and all do you have these? Where do you have these It's found everywhere. All of us are culturing these organisms inside our system. All of us have this, okay? And the saliva, the defensive mechanism is brought about against these microbes by the saliva, okay, which has the IgG, the immunoglobulins there. The sulcular fluid is loaded with that. Then epithelial keratinocytes, along with the Langerhans cells, okay. So you have it in the gingiva, you have it in the pockets, you have it in the plaque which is sitting on your teeth, on your cavity, on your spit and fissures. Everywhere you have these flora which are there looking at you and saying, hi, I'm here, isn't it? A small description of where do you find. I would say predominantly it is the anaerobic microorganisms that you are looking at. You're not really looking at just the anaerobic. There are a few aerobic organisms too as well. Now, if you're looking at the cheek and the palatal area, you have the facultative anaerobes, okay? And then if you're looking at the teeth, you have the biofilm, you have the plaque, which accumulates all of this. The clavicular fluid has both aerobic and anaerobic bacteria. On the tongue, its microbes are diverse in nature, okay? They're diverse in nature because the tongue is the main component that helps in cleansing. When you're articulating and you're talking, you kind of also cleansing your teeth. And that is why saliva is used to cleansing your teeth, right? And you're allowed to, and you're asked to drink a lot of water, and every time you have something to eat to cleanse your mouth by drinking, at least by drinking fluid, so that that completely cleanses, okay? Obviously, you have, if there was a survey that was conducted by in the Journal of Clinical Microbiology, but then these are the a few array of microorganisms that are there that are of importance to you, okay? Now, the resident bacteria, when you're taking your hands, most often resides in your, between the web, on the web of your phalanges, okay? Yeah, you do see them on the surface too, but if you are cleaning them, that is why your hand hygiene technique, when you're mentioning, you are particularly asked to rub on these webs between the phalanges, okay? And then rub against the thumb, rotated around the thumb, make sure you remove them from the fingernails. All of this is being done so that you eliminate the bacteria that is sitting on there, okay? Now, these are some of the bacteria that are resident on your hands, okay? There are some who act as transient. You're picking up, you're touching the surface. I'm touching the surface. I'm picking some of the bacteria from the surface onto my palms, okay? And then I'm holding it there, and I'm kind of, and when I touch something else, okay, my face maybe, then I'm transmitting this onto my face. So that is why your surface pathogens, you're disinfecting the surface is very important in your dental clinic, especially when you are having an aerosol kind of a procedure in this COVID timing, okay? Right. Now, these infections, they're called opportunistic infections because they take advantage of your weakened immune system and they cause devastating illness. Now, what are the opportunistic bacteria? Those that will be there, commensals, or things that you pick up on the surface that are there, either resident or transient. But then there is a weakened link. You got to a weakened link, and you're thinking, hey, this is a good host, okay? And then you get into the host and you produce you eat up all that is available.